Welcome, everybody. The Office of Programs to Enhance Neuroscience Workforce Diversity within the National Institutes of Neurological Disorders and Stroke, NINDS, is very pleased to welcome you to the Open Stage monthly webinar series. This is a targeted outreach effort for our diverse neuroscience community to learn about NINDS programs, network with NIH and NINDS program staff, and each webinar features a different program, division, or cluster, all with the goal of increasing the representation of diverse groups in our portfolio. This month, we are super excited to hear about pathways to NINDS funding for Clinician Scientist. And we'll hear from a wonderful panel of NINDS-funded investigators who will discuss programs to support clinician scientists throughout their careers, as well as a bit of their personal journeys as well. So before we get started, I just have a few housekeeping items. Steve, if you could take me to the next slide.
I'm trying, Anna.
Oh, great, thanks. Perfect. So just very few meeting reminders. All attendees are muted. Please submit your questions anytime throughout the webinar in the chat. So questions in the chat. This meeting is being recorded and it'll be transcribed and archived on our website. You can enable closed captions under the live caption at the bottom of your screen. I'll send so much information in a post-event email, details about where to find this recording. We'll post it on our social media as well, and we'll share a ton of resources, including these slides. So you don't need to worry about getting the slides there. Please do stay connected with us. Feel free to email us if you have any questions. And with that, I'm very happy to pass it off to Dr. Steve Korn to get us started.
Okay, thanks, Anna. Hi, everybody. My name is Steve Korn. I am the director of the NINDS Office of Training and Workforce Development. And the reason I'm here is because I oversee all of the NINDS training programs for clinician scientists at all levels. And co-hosting this with me is Michelle Jones-London, who I think you all know from the Office of Programs to Enhance Neuroscience Workforce Diversity. So I'm going to speak for a few minutes on funding opportunities and really mostly show you some data to try to ease your minds on about success of getting funded. Michelle is going to moderate, and then I'm going to be, there's going to be some talks I'll tell you in a minute, and then there's going to be a panel, and Michelle is going to moderate a panel discussion with hopefully questions from all of you that you can submit in the chat. These are our panelists. It's just a terrific group that we've been able to get. Langston Hawley is a neurosurgeon scientist from UCLA. José Merino is a neurosurgeon as a neurologist scientist from Georgetown. And Brad Schlager is a pediatric neurologist scientist who is president and CEO of Kennedy Krieger Institute. And Langston and Brad oversee two of our big programs, one for neurosurgeons and one for pediatric neurologists. Jose is very much involved in a big program out of Michelle's office that's fundamentally for neurologists, but also for others. So with that, I'm just going to start in on a little bit of information about grants. The funding goal for clinician scientists, obviously the reason you're going to be a scientist is to do research that's going to solve problems that need to be solved. And ultimately, as physicians, you're solving these problems for your patients. But in order to be a scientist, you need to get funded. And the start really of that funding process is with the Mentored Career Development Award, a K-08 or a K-23. They're both really the same. A K-08 is for basic science, a K-23 is for clinical science, but they're fundamentally the same, just what kind of science you're doing. And the reason you're after these mechanisms is because it will give you 5 years of 75% protected time for research. And that gives you the time to get up and running and develop a research program that you can then go off and get funding for in research grants. It provides salary and fringe benefits. It provides $50,000 a year in research costs. And one of the nice aspects of it is you can get an R01, a big research grant, whenever you're ready, and you get to keep the K-08. which is paying a lot of your salary. So again, we're not looking to hold you back and keep you in training. Whenever you're ready to go independent, we'd like you to go independent. I just want to mention this, that for those of you who are students or residents or fellows, many clinicians get an F-32 postdoctoral fellowship. It requires 12 months at 100% research minimum. You can get more than 12 months, but it requires 12 months. We have a lot of neurosurgeons in their research year getting these. There are neurologists in their fellowship years get these. There's also this thing called an R25 for residents and fellows out of NINDS. That's an institutional grant. So you don't apply for that money directly. There are 20 institutions and about 30 residencies in those 20 institutions that make use of this program. And it's basically it supports residents and fellows in neuro anything. It's mostly neurology, pediatric neurology and neurosurgery, but can fund anesthesiology and neuroradiology and neuro anything can take advantage of these programs. And other institutes like NIMH Mental Health have their own. They have an R25 that they use for fellows, and there are different institutes have different kinds of mechanisms to support residents and fellows. I really want to spend most of my time talking about the key to success and showing you some data that backs that up. Number one, we need all scientists to be just outstanding methodologists, understand experimental design, understand data analysis, understand why you use statistics and what statistics is for, not just how to do statistics, but really understand how to design and analyze data. What we have found is that success increases dramatically when there's careful, thoughtful planning in advance for both the research project and the training plan. For the Ks, you're going to need to do this, but in fact, our pre-K programs require this. And rather than going into a lab and discovering what you'd like to do, you spend time talking to a mentor in a lab in advance and come up with a plan. And those plans can change. They can change many times, but rather than wandering around once you enter a lab, you have a thoughtful plan to get going. And maybe as you proceed, things will change as you go along. And the other thing you need, of course, is mentorship. And I sometimes feel like this word gets used so often, the soundtrack of blah, blah, blah goes off and just starts running. And I want to tell you, and if you ask any successful senior or even K-level clinician scientists, really strong mentorship matters. Mentors who are there and will help you and know how to help you. It's not just anybody that can be your mentor and be helpful to you. And we can talk more about that as time goes on, but you need to take mentorship very, very seriously. So what I want to do is show you 4 programs, and I've labeled them 1, 2, 3, and 4. I don't want to talk about what they are because they're all for different populations, but they're all fundamentally built in the same way. And they're built on those 3 bullets about scientific training, planning in advance, and mentorship. And so here's program 1. And you've got the top group, which is labeled those in the program, the bottom, those not in the program, just wherever they are. They're just not in this particular program. This is a program for residents and fellows. It's the R25 I mentioned earlier. But I want you to compare the top numbers to the bottom numbers. If you look at application success rate, which doesn't interest me all that much, that's the number of awards per application. You can see that those that make use of those 3 bullets, the training in science, the mentorship, and the planning in advance, have more success on the first application than those that are not in the program. But where this really hits home is in the last group, which is what I care about, is the applicant success rate. I don't care if it takes you 2 or 3 times to get a grant. All I care about is that you actually get one. And you can see that sorry, that's me. You can see that the numbers jump from, 31 to 49% success, depending on specialty, to 45 to 73% success. 75% success rate in getting a K award, I consider almost 100% success when you account for various factors that are reasons people don't get K awards. And this is also why I say the goal is to get to the K, because our data suggests, I'll show you more data later, that a clinician who has a K award will go on to be successful as a researcher if they want to be, if they choose to be. Obviously, some choose not to be for any number of reasons. And that's fine too. This is program 2. This is the one for neurosurgeons, and Dr. Hawley's going to talk about this program a little bit. But there have been 22 people that have finished the program so far, and these data run through 2022, people who finished by then. And if you look at the second row, the NIH funding success rate, 75% have received NIH funding so far. And some of these people just finished the program in 2022. And so this number is going to have to go up. And if you look down the bottom, 82%, if you count major NIH and private funding, 82% so far have received major funding. These are people that have just finished a 2-year program. And so these numbers are huge. If you look at the R01, these people straight out of this program, over 50% of them have gotten major research grants from NIH. So these are very successful. This is a separate program for neurosurgeon. It's for a different group of neurosurgeons, junior faculty. And this program provides absolutely no money. It's 100% mentorship, and it provides strong twice-a-year mentorship from a centralized committee. And of the first 15 people that have gone through this program so far, 10 of them have gotten major NIH funding. This is purely mentorship. People, good, strong candidates who come in with ideas for a good research program and need help getting their grants written. Mentorship is just, you cannot overemphasize enough how important mentorship is. And here's a fourth program. This is for pediatric neurologists, and Brad will talk about this a little bit. And again, if you look at this is the people who have finished as of 2022, right? That's this past July. 75% of the people who have finished have gotten NIH funding. And you can see the various success rates for different mechanisms. Granted, there have only been 3 people who have applied for an R01 or a major grant, but 2 of them have gotten funded. And if you look overall, 81% of this first group has received major funding. This is after 2 to 3 years of this program. So again, these programs that require advanced planning of both career development plans and research and strong training and an absolute mandate on strong mentorship, people are extremely successful. Some more data. So then you get a K and you say, all right, so I got a K. Steve said, oh, I'm going to be successful. I got a K. What's the K to R transition? And this is R01 or equivalent. So R01, a DP2, which is equivalent to an R01, a U01, which is basically also equivalent to an R01. And you can see that about 80% of people in both the K08 and the K23 apply for one of these. And of the total number of K08s and K23s, in the neighborhood of 50 to 55% have gotten one. But you'll see in the third row, almost 65 to 70% of those who apply for an R01 or equivalent get it. That's 70%. Keep in mind, you may hear numbers like pay lines, words like pay lines. And the pay lines, which is the percentile at which you need to come in study section to get funded, you'll hear numbers like 15%, 17%, 20%. And yet here, 70% of the K awardees are getting funded. And again, this is through 2022. We expect these numbers to go up. Note also from these data, something that NIH program people have been saying for about 100 years, is that your chances of getting funded go way up if you apply. So don't second guess yourself and say, oh, I could never get one. I'm not even going to bother. If you apply, your chances are much, much better than if you don't apply. And in fact, about 70% get them, get an R01 or equivalent. That's huge. That's almost everybody, really, when you think about it. Okay, this is that's the last bit of data I want to show before I turn it over to Langston Hawley. I like to show this. We did this a number of years ago. You see the data is from 2010 to 2018. We looked at all of the R01s obtained by early stage investigators. These are people who are 10 years out from training. And if you look at the number of applications, R01 applications, clinicians submitted 28% of the R01 applications, and non-clinicians, PhDs, submitted 72% of the applications. And if you look at the number of awards, the clinicians got 28% of the awards, and non-clinicians got 72% of the awards, which means the awards track exactly with the applications. And again, we say this over and over again to everybody who complains that NIH doesn't like something, whether it's clinicians or worms or flies or headache or pain. Everybody who doesn't get funded and thinks somehow NIH is against them, clinicians get just as high a percentage of their applications as non-clinicians. And so if you apply more, you get more. And that's just the way NIH works. Obviously, you need to write a good one. So I am going to end with that. I'm sure there'll be many other topics we can talk about, but I'm going to turn it over to Langston Hawley, our resident neurosurgeon scientist. Langston?
All right. Thank you, Steve. I appreciate it. So I want to talk a little bit today about my career path and academic neurosurgery. You know, everybody kind of goes through a different path, and here's what I did. Berkeley, 4 years, med school, UCLA, 4 years, neurosurgery residency, 7 years, spine fellowship in minimally invasive spine surgery for a year after my residency. And then I've been on the full tenure track at UCLA for 19 years since then. One of the things I love about neurosurgery are all the different opportunities to become a clinician scientist. I'm a neurosurgeon, but I'm focused in spine surgery, and my research is focused on spinal cord injury. Whereas I've got colleagues who do almost all brain tumors, and when they do their research, they're looking at brain tumor vaccines, or vascular neurosurgeons that do stroke research. We have functional neurosurgeons who do epilepsy research, and we have pediatric neurosurgeons who do research on congenital abnormalities. One of the other fun things is that we get to collaborate with a lot of different people in neurosurgery with both our clinical and our research activities. In spine, we spend a lot of time with the orthopedic surgeons, brain tumors with oncologists, our vascular neurosurgeons with neuroradiologists, our functional epilepsy neurosurgeons spend a lot of time with neurologists, and our pediatric neurosurgeons with a lot of general pediatricians. So no matter what you do, I think one of the best ways to approach this is to start with a research question or questions. And there are a few things that I think you need to consider. It should be something that addresses a large knowledge gap in your field, something that could potentially shift paradigms the way you treat patients, something that's been understudied. It might be a big disease, but the way that you're approaching it is novel and finding a different way. And then in some ways, most importantly, something that you find to be really cool, because it's going to be your passion that really drives the project. So how did I do it? There's lots of different ways to go about it. What I did was I started with several small intramural and extramural society grants. I had about $60,000 worth of grants in my first year and a half. The other thing that I took advantage of was medical philanthropy, where it also known as grateful patient donations, where as a clinician, you do find patients that are very grateful, who are interested in giving to science. And if you can forge a bond with them, then perhaps they can donate to your laboratory. And then once I got enough money initially and had some good preliminary data, I then obtained an R21. And then after that, I got my first R01. And then I got my R1 competitive renewal. And right now I'm almost at the end and close to turning in my second R1 competitive renewal. So a few pearls along the way. To be a clinician scientist, you really have to align your clinical and your research interests. You can't be in two places at once. It's so much easier if you kill two birds with one stone. So for instance, our epilepsy surgeons take out the same piece of brain almost every case during their surgery. They then send it to their lab, and it's aligned in that way. Same thing with our brain tumor surgeons. When you start your career, you really should plan it out. You know, when you go to a financial advisor, the first thing they ask you when you ask them for advice is they say, well, what's your goals? You know, if you want to buy a house next year, it's very different than if you want to buy a house in 5 or 10 years, what they'll tell you. And you have to think about planning your career the same way. So you have to look at 3 years, 5 years, 10 years, 15 years, and really plan it out. And you'll be shocked if you do this, how well things really line up. Dig 10 holes 100 feet deep, not 1,000 holes 1 foot deep. And that means that when you're doing your research, when you're doing your clinical activities, pick a focused area to work and then dig deep in that. Get to know that area, become an expert in that area. Don't jump around at multiple different areas that aren't related, because at that point, then you become kind of a jack of all trades and a master of none. I like to tell people early on in their career, say yes to most things people offer you. Would you like to give this lecture? Yes. Would you like to be on this committee? We're going to draft some guidelines. Yes. Because if you say no to too many things from the beginning, people stop asking you to do things. And then once you become established, once you have your career at a certain point, then learn to say no later. It's important to find ways to collaborate with others, but you have to incentivize them. It cannot be a one-way relationship. You know, don't argue over who's first author, who's last author. Build a lasting relationship. There'll be so many papers, it won't really matter. You'll forget who's first and last at some point. Steve mentioned the mentors. Mentors are incredibly important. You want someone that has some similar interests. You may have a mentor for one part, for research, maybe another for clinical. And if you're fortunate, maybe you can get one that does everything. But at some point, you do need to demonstrate independence. So you have to have a little bit of an exit strategy in terms of your relationship. You'll always be related to them in some way. But for your dossier, for your promotions, at some point, you do have to show that you're independent. And my father used to always say, the best work is through inspiration, not perspiration. And what he meant was that if you're doing something and it's just purely a labor of love and you're just working hard at it all the time, at some point it'll become boring or it'll become tedious and you'll lose interest. But if you're truly inspired by it, if you truly have a passion for it, then you're going to put in the perspiration you need to. And then my best advice to you is really having great work-life balance. This is actually a picture from about 8 years ago when I coached my son's soccer team. He's there in the blue cap. He's actually now a college football player, but he got his start playing soccer. And if you look at our picture, what you'll see is we had a very diverse team. And it's not a coincidence that our team also finished first with this diversity. And if you take a look at industries, diversity enhances innovation, creativity, collaboration, and overall performance. In terms of academic productivity, if you have a heterogeneous group of diverse collaborators, they tend to have higher journal impact publications than those that are not diverse. And then in medicine, when you look at doctors and teams that are diverse, they do a much better job taking care of patients from disadvantaged backgrounds and have much less healthcare disparities. So this picture here shows part of our problem in medicine is that we have a diversity issue, okay? This first line here, this top line, is the number of non-URM males that are faculty in academic medical schools and clinical faculty over the last 40 years. And you can see a large number of non-URM males, and then it's gone up and maybe plateauing a little bit. Non-URM females have been tracking upwards, which is a great sign. And if you look at these incoming med school classes, you can imagine that perhaps these lines will intersect at some point in the near future, which will be great. Sadly, the bottom is underrepresented minorities, men and women. It's remained relatively flat over 40 years. And if you take the same graph for basic scientists, it's even flatter from those from underrepresented backgrounds. My field, neurosurgery, is a poster child of problems with diversity. We only have about 6% of board certified neurosurgeons are female, less than 4% are Black, and we have about a similar percentage of Latinx. And when you do the intersectionality of it, the cross of race and gender, 0.6% are Black females. So I believe that we have a purpose, both as a group of those of us who work together at the NIH, as well as individuals, to really try to help these disparities, and particularly in fields like mine, which are so bad. So the K-12 program that Steve had alluded to is a great program designed to increase the number of neurosurgeon investigators that will hopefully one day conduct research and get funding. And with this mechanism, you apply before or during your first year as faculty. But there's some commitments with this. Your department chair has to sign off on 50% protected research time for 5 years. You also have to have a detailed mentorship plan, how you're going to be mentored by a local mentor, as well as national mentors. If you get awarded, it's a great award. You get $100,000 per year for 2 years of your salary and $50,000 a year for supplies. Steve talked about the mentorship and just a parallel program that we have where there's no money. It's just purely mentorship and what that's done in terms of grant funding. This is even more. You get the money and you get the mentorship. And the highlight of it all is our annual retreat. That's a 3-day event where you give a talk based on your research, you listen to others, you have workshops, lots of interaction with other junior faculty like yourselves, as well as senior faculty. And you saw the data that Steve showed. It's been incredibly successful in terms of turning these junior faculty into independent investigators with their own funding. But admittedly, we've had challenges, and the biggest challenge is attracting diverse applicants and awardees. And so one of the things that we're focusing on our next 5-year cycle is how to significantly improve in this area, because we're never going to be as good as we could be if we're not diverse. And our field won't be as good as it could be if we're not diverse. So we've got a number of initiatives that I don't have too much time to get into, but just one of them that we're going to be doing. And I hope that some of you listening may fall into this category. What we're going to do is we're going to reach out to every neurosurgery program director and chair and ask them to nominate as many as they want, people from underrepresented backgrounds, be they women or underrepresented minorities, and nominate them for our program, but a parallel program of mentorship, very similar to the Emerging Scholars Program that Steve was talking about. And this is going to be focused on pairing them up with senior mentors who are part of our faculty of our K-12. And not only that, but we're going to invite a subset of that group to our retreat every year to get local mentorship as well. In addition to that, we're going to have a virtual seminar series with a significant part dedicated to EDI issues and understanding the importance in research and healthcare. And then the other thing is we're putting our money where our mouth is. That is, on the application, every applicant going forward is going to have to describe what their plans are to increase diversity in their lab and their institution. And that will be part of the graded criteria. And so we will make sure that the people that are awarded understand the importance of diversity, because otherwise they're not going to get selected. And then by doing this, then they're going to take their labs and make their labs more diverse, and it's going to help grow our field. Thank you very much.
Okay, I guess, Brad, you're waiting for me to say something, so I'll say it. You're on.
All right, thanks, Steve. I'm Brad Schlager. As you heard, if you're on earlier, I'm a child neurologist and a physician scientist. I'm the president and CEO of Kennedy Krieger Institute and professor of neurology and pediatrics at Johns Hopkins. By the way, Kennedy Krieger, we're affiliated with Johns Hopkins, but we're a separate entity. And I also have the pleasure of serving as the program director for the NINDS-funded Child Neurologist Career Development Program. We call it the CNCDP K-12. Now, child neurology is in the name, but we also support neurodevelopmental disabilities specialists. I'm going to tell you more about the CNCDP shortly, as well as the Minority Research Scholars Program, or MRSP, which is our program embedded within the CNCDP. But first, I just want to make some broad comments about being a physician scientist in peds neurology, which is going to really make the case for why the K-12 and other mechanisms for training and career development, as Steve delineated, are so important. You're going to hear a lot of overlap with what Langston just said. And I'll just say very quickly that my background and entree was undergraduate in neuroscience at Brown. I went to Washington University to do the MD PhD program, studied neuroscience for my graduate work, and then basically rose through the ranks at WashU. After training, joined the faculty, was on the faculty for 20 years, ran a residency program, eventually took on the institution-based K-12 program, which I'll mention more in a bit, after training on it, and then became the chief of neurology at St. Louis Children's Hospital at WashU. And then 4 years ago, in a move that I didn't ever anticipate, made the choice to come over to this role as a leader of the Kennedy Krieger Institute, closed my lab. That's a different career pathway discussion. We could talk about it if you like. I want to say that I heard this from Langston too. I love my specialty of child neurology and the closely related NDD. I am surrounded by colleagues who I think have a real sense of being called to the discipline. And historically, child neurology had been a discipline that's really focused on diagnosis and prognosis, anticipatory guidance, along with clinical management using a limited set of often non-specific tools. But this is a really exciting time right now as we have increasing opportunities for interventions that actually change the natural history of what can be devastating diseases affecting the developing nervous system. We also have a lot more evidence basis for the management of common conditions than 25 years ago when I was just getting started. So, but that said, a really a fundamental challenge in our field, and one that does affect the research mission, is this long-standing clinical workforce deficit, which is due to many factors. I'll highlight a couple. One of them is training. It's not as long as neurosurgery, but it's relatively prolonged with 5 to 6 years for standard child neurology and NDD respectively. And increasingly, we're seeing the emergence of subspecialty training. So we see 1 to 2 year clinical fellowships on top. So that's 6 to 8 years out from med school. And we also have issues with visibility and in medical school, which makes recruitment kind of challenging. Recent survey results show that medical students often have no or very limited exposure to child neurology or NDD, or it's delayed until their 4th year of med school, beyond where decision-making for your career pathway may have been already determined. So there are some other forces at play that push on the clinical demands in the context of that workforce deficit. Pediatricians, for real world reasons, are less and less likely to be able to manage the common chronic conditions that are referred to us. There's increased survivorship from all kinds of pediatric conditions that historically had not been survivable, but now are, increasing in the number of patients with chronic and medically complex conditions, and then transition to adult providers for adult age patients is also difficult. So referrals are up and increasing, complexity is high, and then capacity is challenged. So it's not surprising that directors of divisions of pediatric neurology find it challenging to protect the time for early career physician scientists while also assuring that patients' needs are being met, that protected time. And so again, this is a really optimistic period because of the opportunities for an increasingly interventional future for the kinds of conditions that we treat. But it comes about through research that yields effective treatments. So it's critically important that we succeed now in building a larger, well-trained, sustainable, and diverse physician scientist workforce. And the NINDS has been investing in that workforce for 30 years, starting in the early 1990s with the Neurological Sciences Academic Development Award, or NSADA. And that was an institution-based mechanism that provided K-12 level support and protected time. And I did train, like I said, I trained on that NSADA at Washington University and then became the institution-based director. During that time, I was among about 100 child neurologists over the years that the NSADA existed that trained on it. And the overall success of the program, if you measure it based on that going from K support to R01 or equivalent funding, it was uneven. Just that led to the consideration by Steve with the support of the NSADA program directors that we had to go to a national version of the program so that we could more effectively recruit the most compelling candidates and democratize access to this K program so that it wasn't limited to specific institutions that happened to have an award. So that started in 2016. First scholars were funded in 2017, and Steve showed the early returns on the program. We're now in our 7th year. You heard the structure of the supports. It's the numbers now for the K-12 are $110,000 a year at 75% protected time. It's $38,000 of funds for research and career development activities. And we're budgeted for 90 scholar years, anticipating that over a 5-year cycle, we'll have at least 30 scholars and up to 3 years of support each. Now, really importantly, this K-12, we see it as pre-K, meaning we consider that the program should be geared towards applicants who are not yet ready to submit their own individual K-08 or K-23, but our expectation is that the vast majority will go on to succeed in getting their K-08, K-23 upon completion of the support for the program. Now, what's also important is that we consider it to be our responsibility to make sure that the unfunded applicants to our program also have a high success rate of subsequent individual funding. We are a career development program. We see our mission as broader than funding per se. So we provide our 20+ faculty from institutions across the country, provide extra institutional advisorships for our scholars. We have a year-long curriculum. We provide availability of our faculty, not just for the scholars, but for the non-funded applicants as well. Now, there's much to say about the CNCDP, but I want to make sure that I also address our program within the program, the MRSP, which is directed by Dr. Erica Augustine, my colleague from Kennedy Krieger. I suspect many of you are already familiar with Dr. Augustine. She is often on NINDS forums, focusing on mentorship and career development and physician scientist diversity in the workforce initiatives. But unfortunately, Erica had a scheduling conflict today. Otherwise, you'd be hearing her talk about the program that she leads. Like Langston said, child neurology and ND could also be considered a poster case for diversity issues. We lack racial and ethnic diversity. The numbers from recent survey data show that it's about 2% of us are African American, 6% identify as Hispanic. And for physician scientists, as you heard, those proportions are even lower. So we created the MRSP because we're committed to developing a diverse physician scientist workforce for all the reasons that you heard Langston point out. We understand the really pernicious effect that underrepresentation has on medicine broadly as well as specifically for child neurology and NDD. Researchers who come from groups that are underrepresented in medicine are much more likely, there's data to support the statement that they're much more likely to study diseases with health disparities, which is certainly relevant in our disciplines. And the leadership of clinical trials or clinical investigation that comes from underrepresented groups also more likely to result in greater recruitment and retention of missing populations in clinical research, a pervasive issue longstanding for clinical investigation as well. So our program is focused primarily on maintaining and enhancing the enthusiasm for a career that includes research that most medical students leaving medical school, graduating and going on to residency, they state the expectation that there will be some research component of their careers. Over 60% will report that. And in fact, in child neurology, it's closer to 70% will say they anticipate research having a significant part of their careers. Yet if you look 5 years after completion of clinical training, only about 14% are still having research as part of their professional lives. So we think there's a real opportunity to grab that attention and enhance it, the focus on maintaining that interest in research, and to, for the MRSP, go earlier in the residency career and recruit into our program individuals from groups that are underrepresented in medicine and maintain their focus so that by the time they're ready to be applicants at the end of residency training, early faculty, that they can be competitive and qualified applicants for the CNCDP. And every indication is that the program is yielding. It's just that the training pathway is a long time. So we're just now starting to see the product of that work. But we are optimistic that it's a program that will continue to yield. And so I want to make the final point that I think it's really clear that if we didn't have this national version, the CNCDP, we wouldn't be able to have an effective MRSP. It's the larger program makes the MRSP possible. It wouldn't be possible with institution-based K-12 programs. So I think I'm going to leave it there, Steve, and be happy to take questions, I think, after the third presentation.
Okay, thanks, Brad. And Jose, you're up.
So hello, thanks for inviting me. I want to give you a little bit about my path. I'm a neurologist, so it's a little bit of an adult neurologist, which is a little bit different, but a lot of what I'm saying really echoes what the prior speaker, the three speakers before me have said, and it has to do with the importance of very robust training in science and methodology, mentorship, and advanced planning. In terms of career path, I'm a little bit different from others. I'm from Mexico. I went to medical school in Mexico City. That's a 6-year program. Then I did a 1-year master's degree in history of medicine just because I thought that was an interesting topic. And I figured that was the last time I would have a year to devote to an interest outside of medicine, which is not necessarily true. I did a 6 years of residency training. I did a combined neurology psychiatry, 2 years of stroke fellowship. And the fact that it was 2 years is important. I'll get to that in a little while. So that's 15 years of training or medical school and training, and subsequently I've been faculty at various places for 22 years. And I think that the things that my career path has been a little bit different. I've been less funded by extramural funding, more by intramural funding, but I'll talk a little bit about that. But I think that the important thing to highlight is that you may want to know where you want to go. It's important to have a plan of where you want to go, but recognize that there's going to be several detours that are going to take you there, so you can actually take advantage of the opportunities as they present themselves to you in terms of really being able to find funding and time to pursue your interests that will get you to where you want to do. I think that one of the important things that we talked about was the importance of having formal training and really knowing about experimental design, really knowing about statistical methods and about the different things that you're going to do. And that's actually an integral part of K applications, right? Where you identify gaps where you really need specific mentoring or training in the specific areas. As medical students, we learn a lot about clinical medicine. As residents, we learn about clinical medicine. We don't necessarily learn the tools that we're going to need to really be successful in research. So again, here it's where it's important to take opportunities. I mentioned that my fellowship was 2 years. Why is that important? Well, because I wanted to go somewhere where I would actually have formal training in statistical methods, in clinical epidemiology, in biostatistics, so that I would be able to really have a solid foundation. So there are opportunities there. For those of you who are in residency who want an academic career, to look for that kind of fellowships where you will be able to get some formal training. The other thing is to get formal training in terms of what it is you're doing, right? So if you're doing interested in imaging, for example, I'm interested in imaging in acute stroke, well, where are you going to go that's really going to give you the tools that you need, not only in terms of designing studies, but how are you going to get the tools to learn to develop those techniques? And part of that can come through the K Awards. And here in this area of getting the formal training, I wanted to talk about another program, the Transcends Program, which is funded through an R25 by NINDS. It's a program, the PI is Bruce Obiagale and Dan Lackland, who developed the Transcends Program. It's a big name, training in research for academic neurologists to sustain careers and enhance number of diverse scholars. But basically what it's a formal research training and mentorship program for neurologists and others from underrepresented groups and those with disabilities. It's a formal program. It lasts 2 years. And as I mentioned, it's funded through an R25 with NINDS, and also it has some funding from the American Academy of Neurology. And it's structured by one, it has a formal training in clinical research, and participants get a Master's of Science in Clinical Research that's done online through the Medical University of South Carolina, with the goal of, it provides a training that's necessary to transition to become PI of grants or have strengths in clinical translational research. You're also assigned 2 senior researchers who are AAN members who work in the field, in your field of interest, to help you navigate the early stages of your career. And we just heard a lot about the importance of this mentorship, as well as some networking events that happen during the annual meetings at the AAN. And there's a formal evaluation both of the program and of the participant as you go through. So it's a very solid program. There's about 5 to 6 people every year. It's been going on to 2017. And most people get through the program in 2 to 3 years. So looking for those kinds of options, if you haven't had it as part of your fellowship training, is very important. The other thing I wanted, and I did mention the idea of identifying gaps, right? So when you're thinking of, for example, going to fellowship, will I be able to get really the training that I need in terms of the techniques that I need to be able to pursue the research that I want? There's a lot of, in my field, for example, good stroke fellowships. They're aimed to preparing you as a clinician. If you're interested in an academic career, you really have to look for a fellowship where you will be able to learn the techniques that you're going to need. And then the other one is look for real opportunities to develop. We've heard about several funding mechanisms through NINDS, the importance of private funding. There's funding through the organizations such as the ANA, the AAN, patient groups, and so on. So it's very important to identify that. And mentors are going to be able to play a critical role, as will the funding office from the university where you go. But one thing that sometimes it's underappreciated is the importance of finding when you're looking for your first faculty appointment, finding jobs where there's a real commitment, not only spoken commitment, but actually with dollars, to give you time to actually start developing your program so that you'll be able to apply for the successful funding. And this is something that's sometimes often missed, or that's often missed, and that people may not be aware of as they're going through the residency training. So this is something that maybe I wasn't too aware at the beginning, and it led to some initial mismatch of goals and interest. And it's something that, again, through careful mentoring, I may have been able to identify. I wanted to talk briefly about an opportunity here where you do have options, and this is the NINDS Intramural Program. The NINDS has large intramural labs that are headed by a PI, but because those that are based in clinical research require the presence of staff clinicians to do a lot of the patient-related activities. And this is a great opportunity to consider when you're finishing your fellowship. And actually, we could make a pitch for the fellowships in the intramural program. But let's say for positions, the staff clinician positions are important because they will allow you to focus in one particular area of neurology, while at the same time expanding your clinical experience. Working with a PI, you may be able to be PI of your own projects within that large lab. And for me, that was a very important move to actually help me get established, network, get the appropriate mentorship, and then decide where I wanted to take my career. So again, it's the same things, knowing where you want to go. Now, finally, the last few years of my careers have been a little bit further away from active clinical research, and I focused a lot more on editorial activities. That's one thing that has always interested me. And while I was at NINDS Intramural, my PI said, "What do you want to do long term?" I kind of said about that, and his question was, "What are you doing about it?" And that's what made me realize I have to be very much more proactive in terms of pursuing this somewhat not traditional role, which led me to be a U.S. research editor for the BMJ, a big general medical journal, for many years, and now the editor-in-chief of Neurology. So again, this is where I'm talking about the being able to know where you want to go, but see what opportunities you can find along the way that will help you get there. So in the interest of time, I know that hopefully we can have a longer time for questions and conversation. I'm going to stop there, but reiterate the idea that everybody has said about the importance of formal training, the importance of mentorship, of planning in advance, and of really looking for all opportunities of funding that are available to help you achieve these goals, and there are many of them.
Yeah, great. So if everyone can turn on their cameras, and even the audience, if you want to do that, sometimes the head nodding helps people to know that they've answered your right question. In the spirit of, we have actually 7 minutes, I'm going to try to get in as much as I can. Steve is already answering some of the NIH specific questions in the chat. So if you asked a question in the chat, look for your answer there. And I'll start off with what I really thought was a great question that we received from the audience during registration. What are the 3 things that a physician scientist should prioritize over the first 3 to 5 years out of training? And how do you best achieve them? Do you want to start, Langston?
Yeah, I would say get your research infrastructure together first, because what happens is once you get on the clinical train, of being busy clinically, it's hard to get off, and you have to really line that up with your research infrastructure, and that takes more time. The patients will come. There's no doubt about it, but the research infrastructure is so key, because if you don't get that set, then you get busy clinically, and then you never really get to where you need to be on the research side.
Thanks. And Brad?
I would say, I agree, and I would say really respect the importance of protected time. Don't let other bright objects encroach on that really valuable protected time. And then the other piece would be make sure that you have a strong mentorship team so that you can work effectively with the eyes on the prize of getting your initial K award or K to R. Protected time, I think, is the priority.
Yeah. And Jose?
I echo all of the above.
Yeah. And I guess the question we often tell people to build that strong mentorship team, suppose people are not getting the support that they need in their home environment, and especially as physician scientists, these competing priorities. What are some strategies you would recommend to someone who is kind of struggling, wants to pursue research, but isn't necessarily getting that strong institutional support to do so? Do you want to start us off, Brad? We'll go with you this time.
So I think it's first of all, recognizing who are your most trusted sources of consult. So I think if there are others in the field that are maybe not at your institution, to reach out to, perhaps more senior, to navigate that space. I think institutional support is it's a complex space. One of the things that I like to focus on in this kind of advice is making sure that you are at a institution that really understands as a culture of promoting career development for physician scientists. And I think that's the first priority. If that's not where you are and where you want to be is on a career development pathway, it may require identifying a better location to carry out that work. Understanding what the institution has to offer from a cultural standpoint, I think is really key.
It's great advice. And not that this happens very often, but we've all been given the gift of time. I've just been told our end time is 2:30, so we can pace ourselves. Jose, did you want to chime in? Looked like you wanted to say something about that question about how do you shore up a mentoring sort of team around you?
Well, it's important to be in the right environment, as was mentioned. And the other thing is, if you're in an environment where there isn't, I think it's reaching out that's important. Finding someone who you admire, who you think you could go up and start asking around for, I need mentorship in this. What can you help me? Or how can you identify someone who can help me? I think that's very important, not being shy about it.
Not to be shy.
Yeah. And Langston?
Yeah, I mean, there's no rule that says your mentors have to be from your department. And so hopefully you're at an institution and that some aspect of your research is multidisciplinary and that you can work outside your department in parallel fields that do complementary work. So that's one source. It doesn't have to be in your own department. And then the second thing is, you should always keep in contact with the people that trained you and other people along the way. Because some of my best mentors are the people that trained me, or my fellowship director from Tennessee from 20 years ago. And so these people, you never want to burn bridges, and you don't necessarily have to do anything bad to burn a bridge, but by not staying in contact and not staying in touch with people, you may inadvertently burn bridges. So always stay in contact with people.
And so is that just like updating them when you're giving a poster presentation, like staying in touch when you don't actually need something? Is that what you're saying?
Yeah, I think it's important, particularly those who mentored you, to keep them updated on what you're doing, because really you're their progeny in a lot of ways, and so they want to see you do well, and they can continue to open doors for you. Even at my stage of my career, and I'm sure for Jose and Brad the same thing. There's still people that can open doors for them, even though they're pretty well established.
Yeah, it sounds like you're talking about what we always talk about, the direct mentors, but also sponsorship that you need. Let me go to Steve now. One of the questions, especially, sometimes with when we're trying to increase the diversity, especially in this space, something that comes up is this competing priority of money and debt, right? So can you talk a little bit about the loan repayment program?
Yeah, thanks for asking about that.
NINDS handles it.
Yeah, so there's the loan repayment program, LRP, and they have their own website, and it's a great division within NIH. And these are contracts, they're not grants, and they pay off your debt up to a certain amount, which is almost all of it. And the reason the LRP program exists and it's congressionally mandated is that NIH wants to retain health professionals, which in our view are clinician scientists, when they have debt and they might be able to find other ways of paying off the debt more easily, such as clinical practice. And so NINDS funds 4 types of loan repayment, which should cover pretty much everybody. It's people who do basic research, people who do clinical research, people who do health disparities research, and people who do pediatric research, and which is sort of covered by others now. And our first priority at NINDS is clinician scientists. And I can tell you, I'll just finish briefly. I can tell you that if you have a K award, your chance of getting your loan paid off is approximately 100%. And if you are well on your way to a K award and doing all the right things, then you are the next priority and you might start getting your loan paid off before you get a K award. And we work our way down the line in terms of career stage. But if anybody has debt, and again, the judgment is, are you likely to stay in research and become an independently funded researcher? It's not about paying off your debt if you're going to be just a collaborator, and that's not to say being a collaborator is not important, but the goal of the program is to maintain independent researchers, people who are driving research with their own vision. So absolutely keep in mind the LRP program.
Yeah. And so I'll go back to the chat, but right now, as soon as I heard you say, if you have a K, you're 100% more likely to get the LRP. My follow-up question, if I'm in the audience, is how do I get a K? So Jose and Langston and Brad, you have undoubtedly helped to review and have helped many, pre-awardees put together these applications. So what are your best tips or maybe even warnings for people who are developing their Ks? Let me start with Jose this time.
So, I mean, here the key thing is to really identify an area of research that really interests you and where you'll be doing something innovative, and then identifying the areas where you want the help from the K with, right? But what specifically do you want to achieve with that? And also what are the gaps in your training you want to achieve, and really be very clear about that. I think that's going to be very important for your K award. A clear question and showing how this is going to help you in your career towards independence.
Langston?
Yeah, absolutely. I think that's the first thing. And then clearly having the right mentors, I think is key. Making sure you have the right person that's going to support you and almost know when to let go too, right? Because at some point they have to let go, and you don't want to get into a situation where you're kind of working in somebody's lab and become almost, part of everything they do, and you never totally separate. So I think that there has to be that as well.
I would add the emphasis on making sure your career development plan is not an afterthought in your submission. The science can look great. The aims could be really well stated and a compelling set of ideas pursued. But if the career development plan looks like it's cut and paste or an afterthought, it's not going to go well. The K study section or the study sections, as they evaluate Ks, care immensely about it. Also, make sure that your grant application does not read like your mentor did not have a crack at it. If it looks that way, it's also going to be, it gets back to the issue of mentorship. And it has to be clear that this was an application that is put together with the input from your mentor and mentorship team.
Yeah, and I know, Steve, you're chomping at the bit to get in here, and the one advice that you always hear is to talk to you, right? If they're coming in for an NINDS K08 and K23. So real quickly, can you just chime in with your sort of top do's and don'ts?
Well, Michelle, you're asking me to speak quickly on my do's and don'ts?
Yes, we got to go quick.
People have always said, going back forever, that the specific aims page is where you will get your reviewers or lose your reviewers. And it is so important. The specific aims page really reflects how thoughtful you've been in putting together a project. And you need, like it or not, for the most part, you need hypotheses. You need hypotheses that are testable. You need real hypotheses. You're not there to investigate things. You're not there to characterize things. You're not there to identify a bunch of things. You're out there to learn something. And when you get done with your research, you should know more than when you started. And focus on the specific aims page and find mentors who will hate what you've written. If you hand your document to people and they say, oh, this is great, they're not being helpful. It's not great. It can always be better. So you need to find people who will be honest with you and help you. And so that's my quick answer to that, Michelle.
Thank you. All right, a question from the chat. As an earlier trainee, PhD completion, third-year med student, are there recommendations for targeting residency programs with the goal of applying for research training funding mechanisms as a resident and subsequently applying for K awards as a faculty member? So this is coming from an early trainee.
So I'm happy to jump in on this one. As an old residency program director at an institution that cared a lot about K pathways, I think yes. I think because of the importance of having the research exposure during residency and preparing yourself for that post-residency application or post-clinical training, I think being in an environment, being in a residency program at an institution that has a track record and an emphasis is a really good idea, in my opinion.
Yeah, absolutely. And don't just take their word for it. Look at and see what their graduates have done over the last 5-10 years in terms of what type of jobs. Are they going into private practice jobs? Are they going to non-academic jobs? Because if they sell you on all this, but their graduates are going into non-academic jobs, I think that that's a red flag for sure.
Yeah, no, I agree. The residents should be training you for whatever career you want to be having later on, right? So that idea of looking where people go is an important one.
And the other thing is to look at the faculty as who might be good mentors for you. You don't want to just randomly pick a program that's ranked highly or something, and you don't know the players there. You want to really investigate and know who the faculty are, who you think are most likely going to be your mentors, who you're going to bond with.
Okay, and sort of segueing off that, I'm going to combine two questions. There's one question about, for small academic programs with no local mentorship in the field, what do you suggest? And then there's a question about, can mentorship teams be multi-institutional? And given the pandemic, we all know how to use Zoom now and do things virtually. But how have you seen this effectively done, where the mentorship is not at the same institution? Because there is a right way and a wrong way to do that, a way to convince reviewers that it's real. What is your recommendation for doing it the right way in terms of remote mentorship?
I mean, I think it depends exactly what aspect of mentorship you're most interested in, right? So there are a lot of options to get good mentorship that's not necessarily at your institution. For example, I was mentioning the Transcends program, where you're assigned 2 senior researchers in your field of interest who are most likely not at your institution. And that can be very helpful because you want an unbiased view that helps you make decisions as to what you're doing, what you want to do, where you want to take your career, and maybe open up some doors for you at other institutions where there are these options. So I think that can work well. And there are many different programs. The AN has several programs, but ANA and others have programs that can try to match you, especially if you're at an institution without some local expertise, right? Even for residents, the AN has a program to try to do that if you're interested in a particular area. So that may work. It's a little bit more challenging when it has to do with the day-to-day mentoring. If you've got to show that for your funding that you actually have the resources that are available at your institution to carry out what you want to do, that's sometimes a little bit more difficult to do. But let's see what others have to say about this.
Yeah, Langston, Brad, do you want to jump in on this?
Yeah. I mean, it can be a challenge. I do think that's when you lean on societies, other grant mechanisms, the things that we had talked about. Steve had talked about kind of our emerging scholars program through neurosurgery. I alluded to what we're planning to do in the next 5 years for those who are from underrepresented backgrounds. So to take advantage of those opportunities, I'm a mentor for what's called WINS, which is Women in Neurosurgery. And I actually serve as a mentor for 3 different female residents at programs across the country. None of them are on the West Coast where I am, and I meet with them every month or every other month. So there's opportunities out there, but you just have to really look for them.
I think that it goes back to that career development plan. If this person who's outside your institution is the person that should be on your mentorship team, the right way to do it is to make that compelling case that at home there isn't somebody who has all of these wonderful qualities that makes them an excellent part of your team. Unlikely that that's going to sell if that's your primary mentor, as the point was just made. But as part of your team, make the case. And then I think even pre-pandemic, pre-Zoom era, we were plenty of examples of the value of a well-configured mentorship team with extra institutional input if that's what was the right, if that was the right person to add to the team. It's hard to be algorithmic about this. It's making the best case. And the question about the smaller institution, I'd really like to hear Steve's comment about that. This is a challenging one. I think we want to, as I mentioned about democratizing the K-12 through child neurology, we want to be able to support people who are all kinds of settings. At the same time, success requires having the institutional cultural supports that may not be present. So I'm wondering, Steve, how you think about that one.
So, I guess I'm not going to be encouraging. I think if you think about clinical training, if you want to be a stroke physician, you don't go to a place that doesn't have a single stroke physician to train to be a stroke physician. And it's the same with research. You can't train at an institution that doesn't have the mentors and resources to do the kind of work you want to do. And it's a we see it all the time that people apply to do research where there's no appropriate local mentorship, and they don't do well in review, and that they shouldn't do well in review. You need somebody to train you, and that person, you need somebody local who's an expert in what you're doing. And it's a problem. I think you either need to change institutions or change research interests, or occasionally people structure it and it works, but it's really not common.
Yeah, and it's difficult, for residency because there's a match, right? And so you generate your list, and the computer generates its list, and the computer tells you where you're going. And so you might have ranked all these great places with great faculty in your top 5 or 6, and you don't match any of them, and then you're stuck in a place that's not as optimal, right? And so, and I've seen that happen. I can remember people from the interview trail who really wanted to match at UCLA. And there was only 2 spots for neurosurgery, at that time. And obviously most of them didn't. And they matched at a smaller program. And boy, I saw them at UCLA more than I saw some of my co-residents. I mean, every time they could do an away elective or away rotation, they were with us. And so, you can oftentimes maybe do your research year somewhere else. And then in neurosurgery, a lot of the residencies are having where the 7th year, you can have an elective year. And some people choose to do a lot of research that year. And perhaps even your 7th year, you can go somewhere else too. So conceivably, if you worked it right, you could go somewhere for 2 years for your 7 years for research.
Well, that's good to hear. That's more of a hopeful path answer for some people. So that's good. The other question that I had here was, you had said, so Dr. Holly, you gave some great pearls of wisdom. But the one point that I think raised all of our, is that really always true? Is the saying yes to everything. So you said say yes to everything. Brad basically said say no to most everything. Yeah. And so where is the nuance? And especially for diverse investigators like minorities and women who can be asked to be on all types of DIA sort of efforts and experience this minority tax. How do you balance that? How do you create the win-win? What's the strategy?
Sure. And so what I said was, I said, say yes to almost everything. So not to everything. And the caveat is that these have to be things within your passion, within your interest, not random things. So for instance, for me, I had obviously my clinical interests and my research interest aligned. And then as EDI has become really important over the last, 5-10 years, I've been really brought into that. And I made time for that because I have a passion for that. And if I had said, no, I don't really want to do the EDI thing that much because I already got an R01, I'm already doing 200 surgeries a year, I'm already doing these things, I would have missed out on so much by not participating. So I do think you have to be cautious about saying, no, I'm too busy for things. And I think because the truth is, there's a saying, if you want something done, ask the busy person. And the busy people get asked to do things over and over again. And they're the ones that benefit from it and others benefit from them. And I, admittedly, I'm in neurosurgery. When I was a resident, I worked 120 hours a week, for the majority of my residency. And I came into a faculty position with that mindset of doing that. So admittedly, it's not everybody comes from that type of background. And oftentimes when I'm talking, it's more to neurosurgery people who are kind of, that's kind of what we do, and for better, for worse, you kind of sign up for it. But I don't think you should say yes to everything randomly, but things within your wheelhouse that you have a passion for, I do think that you should say yes to the majority of them.
Good. Anyone else want to chime in on that?
I'll take it that the people who are at the next level up, the division heads, the program directors, they should be the ones who are really mindful about not asking people who are in that protected time mode to put pressure on them to say, is this really mission critical or not? So I think it's good advice to say yes to the things that make really good sense right now, and to not miss out on opportunities. At the same time, people like where I'm sitting need to be careful about just one more favor, just one more opportunity. I think because you do recognize that there are these individuals who are capable of doing exceedingly well, whatever it is you ask them to do. It's important to not put pressure on them so that they can stay focused, so that they can succeed in job one, which is getting their research legs and move on to their independent funding.
Okay. Jose, or is this thread done?
Yeah, I mean, I think not much to add.
Yeah. All right. Now let's talk about publishing. There's a question, the phrase publish or perish. So how, in this whole theme of we all have too much to do, how do I work it all in plus clinical duties? Have you ever been able to leverage partnerships or collaborations to actually produce also publications?
Oh yeah, absolutely. Yeah, I think that's key. I think if you're the first author in every paper on your CV, there's a problem. There's a major problem. And so you want to make sure that you, within your sphere of interest, that you have a couple things going on. You shouldn't, I don't believe that you should have only one paper in the hopper. You should have a few different things going on. And I think that as part of collaboration, your role changes, right? So you can't say that I have to be first author or last author, or else I'm not really doing it. And some of them you're more of a middle author. You bring in different strengths to different projects, and you can have multiple going on at once, as long as you feel comfortable delegating, as long as you feel comfortable not necessarily being at the center of everything.
Yeah, I agree. Collaboration is critical here. I think the key thing is, there's a publish or perish idea, and as a journal editor, I love you to publish, but the important thing is you really should focus on projects that are really worthwhile. And that starts at the beginning, right? You started with a question that was really important, that's adding to knowledge, that's changing practice. It's not just replicating for the 18th time something that's been done before. And then it's finding a good team of collaborators. I think that's important in terms of getting the paper done. And as Langston mentioned, sometimes you're the first author, sometimes you're in the middle. Sometimes you'll eventually be the last author. But yeah, it's going to be critical to have the whole team collaboration and trust your teammates in terms of what each can do to improve the papers.
Yeah. And I've also seen in my institution, somebody that's got tons of papers, but they have no grants and they're not going to get promoted. So the publisher perish, I don't love that, because it makes you think if you publish a lot, then you've got it made. And that's not true in many institutions. Certainly the real tougher ones with promotions and dossiers, if you just have a bunch of papers and that's it, that's not going to help you that much.
It's got to be really relevant papers that move the field forward in a way.
Mm-hmm. And then the second question that we always get to this, and I'll direct this to Steve, is how many papers do I need to get a K? What does that need to look like? What's the Goldilocks answer? What's the number?
You need just the right number. I'm just writing something in the chat now that I didn't send. And Jose, your point is just so important. And, Walter likes to say, when Walter Koroshet's the director of the Institute, and I first heard this and it really resonated with me, it's not about you, it's about the patients. And if you're not doing important research, you're wasting your time, you're wasting taxpayer dollars. It's like, what's the point? And doing a small amount of really important work is far more beneficial both to your life, to the world, and to getting a grant than doing a lot of who cares research and getting a lot of who cares publications. So just remember, it's not about funding. You need funding, but it's not about funding. It's about the science. It's about the research. And a little bit of, reviewers recognize it. This person had one paper, but it changed the field, right? That gets you a grant every time when that statement is made. And vice versa. They'll say, oh, this person has a lot of publications, but they're all mediocre. And that's not going to get you a grant. So do important work. Focus on the important stuff.
Okay, I think we went through most of all the questions. And so we'll end this by sort of going down the line and just say, what is your parting advice for individuals in this space that are thinking about making this career in research as a physician? And we'll start off with Langston.
Yeah, I would say that you have a wonderful opportunity to help people. If you're a clinician scientist, you get the best of both worlds. And I think take advantage of that, because you're in the front lines. You get to touch people, you get to see people, you get to really see what it is. And then you also get to apply science and knowledge. So I think it's really a gift, and think of it as that, that you're being blessed with this opportunity versus the other way around. And the other thing I'd say is have fun with it, because it's work, but you really should be enjoying it. And if you're not enjoying it, then you need to step back and understand why you're not enjoying it. So have fun and really collaborate and take advantage of this great opportunity. Thank
you. Brad?
I agree. I'd say it's an extremely enriching experience to be part of the entire tripartite mission. And if you love it, go for it. If after you've gone for it and it doesn't feel right, don't force it. It may not be the career pathway for everybody, but if it's the right one for you, dive all in. It yields in so many anticipated but also unanticipatable ways.
José.
And focus on something that's really you feel passionate about, because then it'll always be fun and interesting no matter what you're finding. So it's got to be something that answers something you really want to know.
Yeah. Well, thank you all the panelists for your wonderful sharing of your wisdom. It's been really, I think, a great session. And I'll turn it over to Steve, who'll take us away with maybe some parting words.
Yeah, I'm just going to say one thing in line with the summaries by the three panelists. And one of the things that's nice about working at NINDS is among virtually all the program directors, their favorite thing to do is to get trainees funded. And make sure you take advantage of the program directors at NINDS or any institute, but NINDS in particular is passionate about training. And, talk to me about any non-scientific issue related to getting a grant from NINDS. The program directors have science portfolios, disease portfolios, and they're the ones to talk to about the science you're doing. And if you don't know who to go to, you can contact me and I can get you in touch with the right person. So we are there for you. And, I would urge you to get in touch. The one thing I would say is do your homework first and talk to your mentor first, because we can be most helpful when you have specific things to talk about and you don't come to us and say, hi, I'm so-and-so, how do I get a grant? Right? That's a really hard thing to answer. So we love to talk to you, so get in touch.
Yeah, and I would say from our office, and Dr. Marguerite Matthews actually runs this program. It's our NIH Diversity Supplement program. It's important to know that if you identify as being from an underrepresented group, and that includes racial and ethnic represented groups, but also persons with disabilities, also disadvantaged, and we can drop the link in the chat. There are ways, especially I've seen a few questions from people that don't really feel like they have enough of an experience or research experience to necessarily apply for the K straight away. Some strategy Langston talked about was using foundation grants, but also if you identify from one of these groups, you can also use the diversity supplement program as a bridge. And so Dr. Matthews in my office is happy to talk you through that process. All it takes is having a mentor who has a funded grant with NIH and a committed mentor and is willing to really help you then bridge to that K. That's another strategy to sort of get your foot into the door and get the pilot data that you need for a competitive grant. The other thing I'll mention is NINDS has a podcast called Building Up the Nerve. Dr. Ulrichs and Matthews hosts that. And it's an amazing look at how the sausage is made, especially season 1. You'll want to listen to that. And that'll help kind of, so when you're, reaching out to us and talking about these different questions, you sort of have a basis for understanding of how we do things. And it's also entertaining too. So those are the two things I'll leave with. And with the last minute, Anna, take it away.
All right, thank you so much to all of our panelists. This was an absolutely fantastic session. As a reminder, we'll send the recording, we'll send all registered attendees an email with resources, links to connect with us, etc. So please look out for that in the next few days. And also, we mentioned this is a series, so please do join us for the next Open Stage webinar. It's on November 30th, which will be on biomarker development and validation. And it'll help you kind of learn about translating discoveries into fit for purpose clinical tools. So thank you so much again. Please stay connected with us and we will see you next time.